call you back. I'm in a meeting.
So I see the notice that the meeting is streaming on YouTube.
Yes.
And who is that going out to?
We actually have a YouTube channel for family to family. So it's a way that we use to record our meetings.
And then is it just streaming or it stays up on YouTube?
It's archived on YouTube. Is there a conflict with that?
I don't think so. I'm thinking about it. I don't think so. When we go into breakout rooms, that's streaming.
Not right. That it's not, the breakout sessions aren't streamed. Just the presentation will be.
Got it. That's absolutely fine.
Oh my God! Look at Kelsey.
Hi, Kelsey.
Look at that! Oh my God! Oops.
Breakout sessions aren't streamed. Just
Oh my God, look at all my peeps. I'm very happy.
Yes. Good morning, Dr. Mosley. Yeah. Hi, Kelsey. So good to see you. I'm so glad you could make it.
All righty. It's 10:02. It's 10:02, and we'll give people 3 more minutes, and then we'll start out. Hey, Carol. How are you?
And so we are live on YouTube. Uh-oh.
I don't know, something happened. Dang. Something happened with my Zoom.
I see and hear you.
Okay, but I can't. Okay, I'm back. Okay. Hey, Laura. This is my friend Laura. Okay, are we ready? Can we get started now? Okay. All right, so good morning and Happy New Year. Okay. Good morning and Happy New Year. Welcome to our Zoom party. Thank you for joining us this month as we start out this new year. I am Lion Suzette Logan, and this is the National Provider Network, sponsored by Family to Family, the Illinois chapter of the Federation for Children's Mental Health. At the National Provider Network, we strive to bridge the gap between people, resources, bringing together organizations, schools, agencies to support the community, local and national. We are a professional network aiming to break down and erase barriers to education. Maybe I should put my glasses back on. That would help the situation. Okay. We are a professional network aimed at breaking down and erasing barriers to education, health, physical and mental, and supporting economic stability for youth and their families. Locally, the National Provider Network represents youth and their families in the townships of Bloom, Brennan, Ridge, and Thornton. Each month, the National Provider Network works towards the goal of increasing access to educational and mental health support by highlighting innovative services, programs, and presenters who address mental health, well-being, social emotional learning, educational services, along with economic and community development. So this brings me to our guests who are helping us to kick off 2024. Dr. Dana Weiner, Louisa Silverman, and Regina Kreider are all here from Governor Pritzker's office to discuss the governor's Children's Behavioral Health Transformation Initiative and how proposed changes will impact families in the Southland. So welcome Dana, Regina, and Louisa. So due to our guests having to leave and go to another meeting, we are changing the format a little bit. We will have our guests tell us a little bit about themselves, then conduct the presentation about the initiative. Then we'll break into 3 groups, allowing people to ask questions and make comments. At that point, then the guests will have to leave. But before we do that, I want to make sure that everyone is introduced to our board of Family to Family. So I first would like to introduce our Executive Director, Kimberly Haynes. Kimberly, take it from here.
Thank you so much, Suzette, for that kind introduction. And thank you, Dana, and your team for coming to be with us this morning. I promised Suzette I would not take a lot of time, but I definitely wanted to make sure that we were able to introduce ourselves as well. So a lot of you all already know me. I'm Kimberly Haynes. I'm the Executive Director for Family to Family Federation for Children's Mental Health. We are a family-run organization, and we do have a really fabulous team that helps us do a lot of really great things in the South suburbs. And so I just want to kind of take a second to just put a couple of names with the faces. So of course you guys know Suzette. She's our Director of Resource Development. So Suzette is the person that whatever resource you need around mental health, Suzette knows it. She knows somebody. She's got over 30 years of experience in the game. We couldn't do this without her. Thank you so much, Suzette. Ariel Donegan is our Director of Membership and Marketing. This is our go-to person when we're looking for a specific person or we're trying to highlight a particular activity or mission that we're on. We work with Ariel. She's also part of the Spider team at Northwestern, so we're very fortunate to have her as well. Dr. Tamara Young is our student services consultant. She is our go-to for all things educational, especially dealing with our babies who are interacting with the special education system. She's a very passionate advocate in that area. She also provides school-based counseling. Erica Lipsy is our Director of Youth Programs, and she's also our child welfare advocate. Erica has more than 20 years of experience in providing foster care and foster care related services. And also Ms. Kristen Hatley, who is the president of I Love Myself with CP and ADHD. She is our resident disability self-advocate. So we are very happy to join you, and we have been talking about this presentation. We are so looking forward to it. And thank you guys again for joining us. And I promise to everybody who's on mute, there's nothing wrong with your system. You will be able to unmute after we let our guests give us this great information. And I am going to turn it back over to Suzette. Thank you very much.
Okay, so thank you for everyone attending. And I am turning it over to Dana. You and your team, the floor is all yours, girl.
Great. And every time I talk to you all, I get so excited, and seeing the pictures of your board, I'm even more excited to be here with like a women-run organization who's doing
Sister
great things.
power.
I
Yep.
got it. I'm so happy. So when we met to prep for this discussion, we all got so energized about what we could do with you that I kind of proposed that, well, we have this big strategy that's rolling out statewide. Could we try it out with Land 53? Could we work with this really cohesive and strong community network and see what you think of the approach that we're going to be taking? And given that you're a family-run organization embedded in the community, I can't think of a better partner to like test this and see, because that's how we do everything. And you'll hear what everything is in a second, but everything we do a test case to see, does this work for people? Does it work for families? Does it make sense to people? So that's what we're doing today. I'm going to give a little presentation, and Regina's going to give part of it too, and then Luis is going to give part of it to tell you what we're doing. But then we really want to go through an exercise with you and see how it feels. Because if you like it, we're going to do it with every community network across the state. So let's go to the next slide. Oh, and I said I was going to introduce myself, which I didn't really do. I'm Dana Weiner. I am a senior policy fellow at Chapin Hall at the University of Chicago, but I am currently on loan to the governor's office, serving as the chief officer for children's behavioral health transformation. I've been doing that since February of 2022, when the governor said, we need to fix this children's mental health system. And you'll see why I put it in quotes in a second. We need to come up with a better approach to meeting the needs of young people. There are mental health problems on the rise, and we clearly don't have the capacity to meet them. So I've been doing this job since then, and that means that I work across the 6 child serving agencies. Can you go to the next slide, Louisa? So what we're going to do today is I'm going to quickly give you an overview of the Blueprint for Transformation, which is our master plan for how we're improving children's mental health services. We're going to pretty quickly zoom in on recommendation 12, which Regina is going to talk about, and she is leading that work for our whole team. Then we're going to hand it over to Luisa, who's going to show you, we built some custom materials for you, a list of providers that we know about in your community, as well as a map that you can interact with and scroll over and find providers. And then we're going to go into rooms to hear, because we want to hear, what do you think your strengths are in your community? What do you think your needs are? So that's what we're going to do. So go to the next slide, and I'll start my little walkthrough of the blueprint. I already kind of said the governor wanted young people with mental health needs to get their needs met through services, either in their community or if they needed residential treatment, and that their families have transparency and clarity and know how to access services. One of the big problems that prompted this work was, you probably heard in the news in the winter of 2022, there were kids who were DCFS wards in the hospital beyond medical necessity, and nobody knew what to do about these kids. There are about 55 of them. Those kids were like the tippy tip of the iceberg. There are so many kids in our state who need help who are not getting the services they need. And so since then, that has been my mission, to solve this problem. So let's go to the next slide. And you can just click through, click 6 times. Yeah. So I said I'm supposed to fix this system, but it's not really a system. As you know, it's a patchwork of programs and strategies operated by 6 child serving agencies, including the Child Welfare Agency, which is DCFS, DHS, which has divisions of developmental disabilities, mental health, and substance use prevention and recovery. Then you've got the Department of Juvenile Justice. They offer a lot of services to kids on aftercare. You've got the Department of Public Health that oversees inpatient hospitalization of kids. You've got the Illinois State Board of Education that oversees 852 local school districts who all do different things for kids who have individualized education plans. And then you have the Department of Healthcare and Family Services, which is the state Medicaid agency. So let's go to the next slide. So I talked to a lot of people about the problems in our state, but I also talked to families. And what I heard was, particularly for families whose kids needed intensive services, like residential services, getting to those services was like navigating a vast unmarked forest on trails with no signs. And what you get depends on which doorway you come in. And we have to change that. So what we're trying to do, go to the next slide, is to change it to something that looks more like this, where no matter which door you come in, you're met with a park ranger or a navigator to help you, an information kiosk to give you all the information about eligibility, and a clearly differentiated array of the types of services that kids need. And I'm actually sitting here today in the offices of Google, who's going to build this centralized system for the state of Illinois, which we're going to announce a week from Monday in a press conference with the governor, but you heard it here first. So let's go to the next slide. In order for the system to look like that last pretty picture, we have to rebuild it from the inside to look like this. We have to have a centralized place for families to go to get information, to get service referrals, or to get help from the state if they need more intensive services. And that's what we're working on building. So let's go to the next slide. This is just in case you haven't seen the blueprint. You can scan the QR code, you can click on the link, or I can put the link in the chat once I hand it over to Regina. This is what the blueprint looks like. And next Monday, a week from Monday, when we have the press conference with the governor, we're going to release the progress report on the blueprint, because we've all been hard at work this year and a half implementing the strategies in our plan. So let's go to the next slide. There are 12 strategies in the blueprint. 4 of them are focused on centralizing and streamlining, making it easier for people to get to the services they need. And that includes 2 pieces of technology: this centralized care portal that I'm working on building today, as well as a resource referral tool that would live on people's smartphones that you would all have access to. There's 4 more strategies focused on adjusting capacity and making sure that the services that people need are there. And we're going to talk about that today in the context of Land 53. And then there's 4 more strategies that have to do with getting upstream of problems, because a lot of these kids that end up in the hospital, if they had gotten services earlier on, I mean, the Surgeon General was quoted as saying, on average, it takes 11 years from the time a problem is recognized in a child to the time they get an appropriate service. 11 years in the life of a child is just unfathomably long. So we are working on changing that. And one of the strategies that we're working on is number 12, which is strengthening community networks, of which you are one. So that's what we're talking about. That's what our focus is today. And Ariel, great to hear that you work on Spider. I should have also said, as part of my introduction, I've been doing this work in support of child serving systems for about 25 years. And in 2002, I built the database that served as the beginning of Spider. So just there's a little thread of connection there also. Let's go to the next slide. Okay, so I'm going to hand it over to Regina to talk about the specifics of recommendation 12 and how we're going to be doing this work to strengthen community networks. And then we'll show you the materials that we developed for you today.
Thank you, Dana. So my name is Regina Kreider, and I'm a senior policy analyst at Chapin Hall, the parent and community liaison. I am a parent with lived experience. I have navigated multiple systems for my now 24-year-old daughter, who I continue to navigate systems with and for. But I'm excited to come here today to share with you about the work that we're doing at the Blueprint, specifically talking about recommendation and strategy number 12 of fortifying our community networks. And so when we're talking about implementation, there's a whole process that we go through, and it starts out with the design plan, the install, and then the implementation. And so far, this just gives you a little brief overview of some of the things that we've done so far specific to this recommendation. I won't dive into this, but it just kind of shows you some of the steps that we've taken to this point. Next slide, please. So as I began this work of working on recommendation number 12, one of the things that Dana and I discovered was that we needed to come up with a uniform definition of what is a community network. So we came up with this definition that it's an ecosystem of diverse stakeholders coupled with graded supports that can help prevent and mitigate crises by connecting families. And this is the part that's most important about this definition is what they say they need to thrive. So when we're talking about those community networks, we're basing that need on what families are saying that they need. Next slide, please. So in my mind, the way we were constructing this, we're looking at having developing a system that was similar to the lands. This will be a little different, but it's similar to that. We want to develop network anchors in each of the various communities. And each of those network anchors would be responsible for coordinating meetings, doing community outreach, facilitating training, and even managing projects. But the network will consist of community members and leaders, parent and youth will be a part of that network, providers will be a part of that network, as well as child serving system leaders. So we are looking at encompassing everyone in one big happy family, one big meeting where all voices are coming to the table to do this work of developing what types of services and supports that families need that's specific to their community. And the bulk of that work will be taking place through that network anchor. They'll be facilitating those conversations, those meetings, and bringing folks together. Next slide, please. So where we started our work was we began to do some inventory of what's out there. What are the community networks out there? And so I remember I met Kim several years ago on a different project that I was working on, and I reached out to her to see if her local area network was still in play. And lo and behold, it was kicking, thriving, and doing well. So it was really exciting to reconnect with her. And from there, we discovered that there were more local area networks that were out there. So we did an inventory. We discovered that there were more local area networks that were still in the state of Illinois that were active. We discovered that there were some systems of care mental health grantee sites that are out there doing the work. And those sites are funded in various ways, specifically from SAMHSA or from the Illinois Children's Healthcare Foundation. There are 708 boards and 377 boards. There are local health departments within the counties and townships. And then we have those organic networks that are out there just doing the work of coordinating and developing services for families throughout the state. So we realized that we had a lot more going for us in this area of community networks than we thought. So what do we do at Chapin Hall? We put it on the map. Next slide, please. So as you can see, what we did was we took all of the information from that site with the names on it that we just talked about, and Louisa, who is our map guru, put this beautiful map together to just show what's available out there throughout the state. So as you can see, based upon the key here, that we've mapped the local area networks. We also mapped the organically formed networks, system of care grantee, 708, 377 boards, local health departments, and then the counties and townships. And as you can see, we came up with this beautiful map that shows that Illinois really has a lot of the infrastructure that we need in order to develop this network of community networks throughout the state. And then you'll also see that in each of these various areas, and this particular map is mapped based upon the designated service areas, or the DSAs. And as you can see, in each of these DSAs, there's overlapping areas. So we have a wealth of communities that are continuing to do this work. Some of them are funded, some of them are not funded, some of them are just coming together because they know that this is good policy to do this type of work within the community. So this is one map that we worked on that's specific to DSA. Next map, please. And then we also took that same map and we broke it down by our Illinois Department of Public Health regions to also see what that looks like, because IDPH will be one of our collaborators that we'll be working with as we continue to develop and roll out this piece of our strategy is IDPH. So you can see the DSA map and you can see the IDPH map. But the most important thing about the map is that you can see that we have so much infrastructure that's already in place. Next map. Next slide, please.
Oh,
is this your slide?
Yeah. So, okay. I feel like I should have said this at the start. We take a strengths-based approach to everything. That means I don't want to reinvent the wheel or uproot or disrupt anything that's in place that's working. So the reason we're here is because you are a network that is thriving, and we want to build you up, find out what else you need, how can we help. And the reason we started with that inventory that Regina just showed you is because I didn't want to come up with a new structure and wipe out anything that's happening that's helping people. I want to make sure I'm leveraging, and even if it has to be a patchwork and not everybody's using the same, going about things in the same way, if it's working, we keep it. If it's not working for people, we got to put something in place that learns from the things that are working. So I should have said that at the front. I hope nobody was getting nervous hearing us talk that we're going to change anything about what you're doing. Not at all. In fact, we want to make it possible for other networks to learn from you. And that's going to be part of the exercise that we're doing. So what we decided to do was, based partly on my conversation with Kim and Suzette and others in your network, were to prepare some materials that would help you visualize the assets in your community and the resources so that we could try out this approach to having a conversation about gaps. Now, I fully expect that you know more about your land than we do, but we're going to show you, and Ariel, it comes from Spider, we're going to show you the information that the state knows about all kinds of resources that are in your land, and both in a list and in a map, and then ask you to talk through with us where you think the prioritized gaps are. This is part of a larger effort because we want to do this all over the map that Regina just showed you, and we're going to rely both on the Illinois Department of Public Health and the Illinois and HFS as kind of ambassadors to this work. So because there's only 3 of us, we're not going to be able to talk to every one of those networks all over the state. So we're trying to partner with state agencies wherever we can. But today we're trying to kind of test our process and see if it's something we could put out to our IDPH and HFS partners. And then we want to work together with program development for the state and the county to say, okay, we heard from the land, they need this and this. How can we leverage the funds that you have to prioritize that and make sure that they get the programs they need? So let's go to the next slide. And Luis is going to talk you through the maps that we did for you. And then we'll break into groups and do this little exercise. So take it away.
Sure, yeah. So I'm just going to walk you through this different map that we put together to show which providers are in the state of Illinois, but specifically we'll focus in on Land 53. And just so that you know how to use the map for when we go into breakout groups and talk about this in a little bit more detail. And just to give you some background on the map. So the purpose for putting this one together is to help in planning and kind of recognizing where the strengths are, where resource gaps are, and things like that. It's not necessarily meant to be a tool to identify specific referrals for individuals. This is more of a planning resource. And because it comes from Spider data, we have mapped out 6 types that are identified through Spider. So mental health treatment, substance use treatment, parenting, early childhood, non-clinical programs, and health providers. So those are the categories that you'll see. And then this is just a picture of Spider, which I'm sure a lot of you are familiar with, to show that that's where we got this data from. And we are, as part of this project, working on more resource referral tools that will be meant to be used on a more individual basis. So won't get into that now, but just to note that. Okay, so this is what the map will look like. And I know that you all know where Land 53 is. This is more for our team. But the different colors of the points represent the different categories of providers. And so how you'll access this, we'll be able to send you out the link afterwards, and we'll send it to you like in the chat once we go into our breakout group. So just click on the link, and then this is what will come up. And then we'll zoom in to the Land 53 area, just like using regular Google Maps, by where the little red circle is, the plus and minus. That's just how you zoom. You can navigate around the map that way. And you're welcome to look at other areas too. And so you can also filter based on the type of provider that you're interested in seeing. So this is just an example, but you can just check and uncheck, and the points will show accordingly. And okay. Like I mentioned.
Oh, sorry.
Go ahead.
I don't know I can't remember if your slides show it, that you can scroll over to see the details of an individual provider.
Yes, I will show that. I think that was the next one. So yeah, like I mentioned, this is just kind of a key for what the different providers mean, but it's kind of self-explanatory. You can see the colors of the points will be right there on the map for you. And so one more thing before I get to the like covering over providers, but this map also shows the two boundaries that the other maps showed. So the designated service areas are an option to check that right now, so unchecked there. The Illinois County boundaries are an option to have show up, and right now that's what you're seeing as the red lines. And then the Department of Public Health regions are also, you can make those show up. So just depending on how you want to be thinking about this, how you want to be using this map, these are more tools that you have in your toolkit. And then you can search for either specific places or general places, and it'll pull up, because it is connected to Google Maps, it'll pull up like anything that Google Maps has registered, which you can see like on the bottom, and then it'll also show up with points, the ones that are on the map. So if you're thinking, oh, what about this service provider? I can't find them. Are they on the map? Then you can search them, and if they come up with a point, it means they are. If they come up without a point, it means they're not. And so that's something to note that maybe we have missed, or you know, an area to build this out more.
Can I ask one other question? Just something. So we also sent you a list of all these providers in the meeting invite, I think, right? We sent it. I don't know if it got sent out to everyone.
Yes, we have that.
Okay, so the list is alphabetized. So if you find it, if you want to just check and see if a resource is there, the list has everything that's the points are up. Sorry if you already said that, Louise.
No, I did. Yeah, thank you. And in the list, there's different tabs. So just it's like an Excel workbook. So just I'll note that, like, if you don't see it on the first tab, they're organized by the same categories of the 6 types of providers. Okay, so then this is what Dana mentioned about how you can, this is one of the most useful features. I think you can click on any of these points and it'll bring up the information about it. So the name, the address, phone number, and the programs that they offer. So with any of these points, you can get that information. And again, that's all just taken from Spider. Okay, and then finally, you can click on the boundaries that are linked here, and or that are, you know, that show up there, and it'll show you information about that. So either the county or the DSA or the health region, if you're just curious, like, oh, what is that around there? Okay, so with that, we will go into breakout groups, and I will we can, you know, go over if you have questions or if you're unsure about how to use these the map or the list or anything like that. We can talk about that more in the breakout rooms, I think. And Dana, what time should we come back together?
So first of all, okay, it's 10:34. I'm going to send us to 3 breakout rooms, and Louisa, Regina, and I will each be in one of those rooms. I hope that works. I'm not assigning people manually. I'm assigning automatically. So if Louisa, Regina, or I end up in the same room, we'll have to move. But before I do that, does anyone have, Kim, how hard is it to take people off mute if they have questions?
So I just opened up, so anyone who wants to come off of mute to ask a question should be able to. And then, you know, one of the things that I saw when I was reading through the blueprint and hadn't really touched on it, I know that there was some language that really addressed the disinvestment in Land 53 over the years, and specifically looking at how Medicaid has become the primary funder. And I know a lot of organizations that we consult with that are in our network that are really on the ground level trying to do this work, that Medicaid funding is really a barrier. And so I don't know if that's something that we're going to kind of talk about, or do you want to kind of push that to another conversation? But
well, let me clarify. So there's a couple of ways I'm interpreting that. I know from the history that if you are a person with Medicaid, sometimes like you can find a psychiatrist, but not one that takes Medicaid. So there's that aspect of the problem. But I think I'm also when you say that if you're a provider, are you saying it can be hard to enroll as a Medicaid provider, or that they don't pay enough to make it sustainable for you to be a Medicaid provider?
Well, one of the biggest challenges that we have in 53 is that we don't really have a lot of community-based services. When you come to our monthly meeting, we always have a mental health hospital that provides those services. But when you talk about early intervention and these preventative services, we're at a loss. You know, even when we talk about, peer support for parenting, we don't have a lot of those providers. And even in the sense of us trying to kind of encourage smaller organizations to get involved and to provide these services, because our area is one of the larger lands. So transportation is a huge issue. And having those services that are accessible in the community is really an issue. But one of the problems is that the providers don't always take Medicaid. And I'll give you a very prime example. Schools are asking us for school-based counselors. However, we probably have about 15 or 20 qualified mental health professionals that can provide school-based counseling, but they don't take Medicaid.
Yeah. Okay. So, oh my gosh, Kim, you just said so many things that are important, and you clearly did a good job reading that blueprint, because you picked up on some nuanced things that we're now working to address. So I want to say two things, and I'm going to resist the urge to show you a whole bunch of other slides because I'll eat into our time too much. But okay, let me say the second thing first, which is that we are working in a separate channel to try to increase school ability to claim Medicaid for services like the ones you're talking about. So there's an untapped opportunity there where schools, if somebody knew how to do it, and there are a few people in our state who know how to do it, but not one in every school or every school district. If school districts knew how to, they could do a much better job of maximizing the Medicaid funding they pull down to do things like provide mental health services. So we have started that conversation, and I'm going to keep you in mind to brainstorm about it. The other thing I want to say, though, oh, sorry.
Oh, no, go ahead, please. Okay.
The other thing I want to say is that traditionally, and this is where I'm resisting showing you more map slides. Traditionally, the way the state agencies have thought about spreading out resources has been like they put more where there's more people, and they're not really thinking about like where is the highest need. So what we did as part of the blueprint development, you'll see it in appendix, maybe it's appendix C, is we said, well, what are the factors that increase mental health service need? Exposure to violence, economic hardship, among other things. So we prepared adjusted maps of need. And I just this week had a meeting with 2 different people at DHS. And I said, can you use these maps instead? You're going to put out these new NOFOs, Notice of Funding Opportunity to Develop More Services. Give extra points to the places that have higher need, because we need to bump those places to the top of the list. And we can go back to those maps and see, but it seems like that would be something that would help address this problem, that if you take just a purely population-based approach, you give too little to the places that actually need more. So I'm trying to address that by plugging it into the places in state government where they fund services. Yes. I saw Paula had a question.
Yes, I saw Paula's hand too. Thank you so much, Dana.
Sure.
Thank you so much. And this is just a really good conversation, because the division that I am the statewide administrator with the Department of Children and Family Services for the permanency enhancement. And the vision for that program is to elicit 100% community to looking at our families to be able to thrive with 10 vital services. Those services being able to address the needs of the families, and that the community then comes together to look at the services that they have and to be able to show up, and then be able to say within the community where those service gaps lie, where are the funding sources, and then how then can we access those services. So, I heard the conversation about not it being the land, but actually the blueprint is kind of simulating exactly what we're trying to do in terms of getting soft services to look at healthcare, to look at food deserts, to look at transportation within birth for the community to be able to come together to talk about where services lie, where our families can access those services, and to get other agencies like DHS and HSF, because our families touch those entities before they get to the department. And so what we're trying to do is to be able to have the families to be able to access those services at the community level. Yeah. And to provide those supports. We work with the university partners to provide strategic plannings for the lands, to do exactly that, to survey, to access, and to be able to have funding to be able to address those services within their communities. Right. So I'm excited. I get excited every time I talk about it. And it sounds like, you know, we could come together to talk about how we could do that.
Yes,
yes. Well, Paula, I think we're coming together right now.
So,
right?
But I'm not only talking.
I'm glad that you can make it today, Paula. I know that you got a lot of responsibilities, and we really do appreciate the support that you've given us in terms of family to family playing a role with the Permanency Enhancement Project.
And Paula, happy to talk with you another time. I'll send you the maps and we can have a chat about how that could help.
Perfect.
Right now, I'm gonna create the rooms. We're gonna have 10 minutes to talk, I think. And then we're gonna come back together at, well, let's say I'm gonna give us maybe 11 minutes. We'll come back together. It'll be like 10:55 and then we can wrap it up. And Louisa, I put the blueprint in the chat, and Louisa put a link in the chat to be on our mailing list so that you hear about everything we're doing. And I hope this works. I hope nobody gets lost in cyberspace. And we're all going to see each other in a minute. So I'm going to send you to the rooms, and then Louisa, Regina, and I will lead us through this exercise talking about community strength and needs. So here we go. Let's see.
And Dana, I'm so sorry. What time did you say? I was typing in the chat.
Well, it's going to give you, the rooms are going to close. I'm going to bring us back together at 5 till. But right now, hold on. It didn't do, it put, oh, it's, so Louisa, go to room 1. I'll go to room 2. Regina, you go to room 3 because you're going to have a choice.
Got it.
Okay. Okay. So good luck, everyone out there in cyberspace. You've all been invited. Join your room.
So did we designate which room was what?
Yeah.
You just should have gotten an invitation. Oh, the host didn't get one. So Louisa goes to 1. I go to 2. Regina goes to 3. You all hosts can pick. I didn't realize.
Okay.
I'm going.
Okay, so I'm going to join room 3.
Okay.
Okay, with Regina.
Okay.
Okay. I hope everybody else made it through the transition. I think it never ceases to amaze me that you can do that and put people in rooms and they didn't move and they all make it happen.
Yeah,
Like,
and I don't see anybody. Well,
no.
let's see.
Well, it give them like 30 more seconds.
Yeah, well, you know, when the conversation is good, they wait until they are forced out.
Absolutely, because
Carol, so good to see you.
Good to see you too. I actually hit the end meeting by mistake. I wanted to stay. We had like 40 seconds, so I feel bad I didn't stay to the end.
Wait, you hit end meeting?
No, not end meeting.
No, she left the main meeting.
Oh, I see.
My breakout. I clicked on ending my breakout by mistake.
I think everybody made it back. You all survived.
Yeah.
Nice.
Regina, Louisa, we don't have as much time as we thought to report out, but we have these worksheets. So Kim, we will send them to you. We'll clean them up and let you know what we talked about. I would just highlight from our group that there's a lot going on in your community in Land 53. It may not be all of what you need specific to mental health, but it sounds like there's a lot of activity and organizations that are very engaged in the community and providing services to kids, but they might not be specialized mental health services. Non-clinical services is things just like that, like after-school programs, mentoring, tutoring, things like that. Also, it was interesting to hear from Kim and others in the room about all of the things that make your network strong, that include partnerships with other organizations, raising the visibility of some community organizations so that everybody's aware of them, engaging youth, resource fairs. I'll stop there and just quickly say to Louisa and Regina, we're not doing a full report out, but is there anything you want to elevate or highlight from this? And also, our group likes the exercise. They think it will be productive to do this all across the state using these materials. So I was happy about that.
We didn't get that far, but we did get to prioritize. So I'm looking forward to
prioritizing.
Okay.
So anything in particular that you want to share before we leave the group, or just stuff to send?
I'll second what you said about the networking and communicating about existing resources and services and things like that. My group also emphasized that, so that I would raise that second. And also I would just tell everyone we didn't get the chance to like talk about the exercise itself and how it worked for you all. So if you have feedback, please feel free to reach out. And I put that form in the chat, but I'm also just gonna put my email address. And so please don't hesitate.
And I just want to express so much gratitude to you for letting us come in, try this out, partnering with us, for everything you're doing that's helping kids and families. And Kim, I hope this is a to be continued. This is not a one-off. Like, please, let's keep in touch. You should be our go-to for like, we have a question, is this going to work with other networks? We would love to just keep partnering with you. You're doing such great work. Regina, do you have anything?
No, I'm good. Thank you very much. And thank you once again, Kim. It was great reconnecting with you and your team. And we're looking forward to our continued collaboration.
Yes. And one of the things that I would like to maybe throw out there is maybe that we, you know, once we get a chance to kind of go through the forms and everything, and I'll put this out to everybody who's a part of the network. Dana, you mentioned that, of course, this is usually not an activity that you do in 10 minutes. And so I think it would be a good idea if we consider reconvening to actually go through some of those tools and assessment pieces a little bit more thoroughly, because I know we have been able to work with UIC to pull some data from DCFS. And I think, Paula, you're absolutely right. Data is king. And the tool that you shared, Louisa, with all of the organizations on there, one of the things that we talked about as we were kind of prepping for this meeting was really organizing some outreach to see if we can't do our own research and bring in those organizations to the table. So I would just like to make sure that I put it out there that we will definitely love to invite you guys back. And maybe we can have a time to really walk through some of those tools and resources. They were really helpful.
Absolutely, yes. We'll be there.
Okay.
Sorry we have to leave you. We're just booked really tight today, but we're glad we got to spend an hour with you, and we hope to be back soon. And thank you so much for everything you're doing.
Yeah, I just want to reiterate what Kim was saying, and please, please, please come back
Yes.
to our party. We party once a month.
I love a party. I'll be back.
Have a good day.
All right. Bye-bye.
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 See you later.
All right, thank you guys so much.
Okay, so they're going, but we're just going to keep this party going.
Yes.
So we're going to have people to introduce themselves and then tell us a little bit about who they are and where they're from. And then once that's over, then we're going to have our executive director, Kimberly Haynes, come on and talk about some vision that we have for 2024. So first up, I would say welcome Kevin Brown.
Hello, how is
Hey.
Hey, I'm down here in Chicago.
Okay, and I am too, but let's go on.
All right, so thanks for having me. I was vice president of the Windy City Lions Club, then moved over to COPE after having several conversations with Kimberly. And actually, it's a better fit for what I do. I'm with Varsity Tutors, and we work with a lot of school districts offering academic support. And one of the things that we're offering right now is we're offering all districts in the state of Illinois free platform access, which has a ton of resources. I mean, currently we're working with Illinois Department of Juvenile Justice, Lincoln Elementary School District 156. So Dr. Young, she knows me very well. We've collaborated with her on several projects. We're trying to work with Thornton Township. Dr. Rice is writing up a grant to work with us on them. So we work with several different school districts, and this platform with access we're offering is going to kind of close that equity gap. It's going to allow students to have access to things such as homework support, enrichment courses, SAT, ACT, school prep, college prep readiness. Actually, even writing coaches will be there to help them with the writing. So there's several things that we're offering, and it's absolutely free till I think June 30th, 2027. So I'm putting that out there to any of you in your areas and regions that you're out there. When you see those schools where students are struggling and they need additional support, we're offering it at no cost for 3.5 years.
Well, welcome, my lion brother. And I'm sure that Kimberly has your information.
Yes.
So if people on this platform are interested in obtaining that, then they can contact Kim, and Kim can facilitate that information. But thank you, Kevin, for joining us.
You're welcome to the Lions Pride, Kevin.
I have my service pin right here. Okay, so next up we have Miss Paula. Hey, girl. You on mute, Kim.
Hello.
You should be able to unmute. Yeah, she can do it.
Yeah. Good afternoon. Good afternoon. I'm sorry.
It's still morning.
It's still morning. It's still morning. Paula Trudeau Lohan from the Department of Children and Family Services, statewide administrator for the Permanency Enhancement Project, working within communities to really bridge the gap of service provisions from providers, as well as strengthening families through community-based services.
Okay, well, thank you, Paula.
Along. I appreciate you guys the invitation.
Thank you.
Glad you could make it this morning, Paula.
Yeah.
Paula probably had to move some stuff around to be with us. You all don't know that's a busy lady.
So next up we have Miss Carol Watson, my friend.
Okay.
Legend.
Yes, I am so glad that Suzette is continuing to work with Land 53 as well as Kimberly. Kimberly, I retired almost 3 years ago, but my last job was recruiting foster parents, and I was a resource worker And Paula, listening to what you do reminds me of Harold Dixon, because you took over Harold's position after he retired. So I'm so glad to see the department is involved in Land 53. We've struggled for many years. The invitees, the presenters this morning took me back 30 years when DCFS funded the different lands to get them started. So, you know, things come back around. So this community certainly deserves your efforts. I retired, as I stated, but I'm a trainer. I'm training foster parents and adoptive parents, prospective, and those currently in those positions who are looking for certification to adopt, and, you know, different topics that I'm training on. So I'm going to stop there, and thank you. Glad to see everyone.
Well, you're welcome, Miss Carol, and we'll maybe have to have you back sometime during the year to do a presentation on what it is that you do.
Okay, we'll see.
Okay, all right. Okay, so next up we have my girl, Shanae Wings. Okay.
Good morning, everybody. Good morning, good morning. I am Shanae Wings from River Edge Hospital. We are the largest freestanding psychiatric behavioral health mental health service freestanding hospital in the state of Illinois, located in Forest Park, servicing the lifespan children as young as 4 all the way through adult seniors, inpatient, outpatient services, inpatient short-term stabilization, outpatient services, including one-to-one therapy, IOP, PHP, medication management, and other groups and services.
Well, thank you so much. Okay, Kimberly, I'm skipping over you because you're going to talk when we're done. And then Ariel, do you want to have anything to say? You were introduced as a board member, but as always, my darling, you can have a little say if you want to.
Hey, y'all. How y'all doing?
Hey.
You know, I'm Ariel, the Director of Membership and Marketing for Family to Family, but I also work for Northwestern University and DCFS on the Spider team that Dana created. So, hey, everybody.
Well, there you go. Okay. Next up, we have my girl, Maureen Hall, and I'm so glad that she was able to join us. Take yourself off of mute and tell us about your organization.
Good morning, everyone. It's always a pleasure to be here. Thank you, Suzette and Kim. It's always a pleasure to get the new information. As they stated, I am Maureen Hall. I am the owner of Premier Treatment and Counseling Services. Premier Treatment and Counseling Service is a substance use center that provides addiction treatment to adults and adolescents. So we also offer anger management as well and DUI services, and we are located in Flossmoor. So we're accepting new clients. So if anybody has anyone that has substance use disorder or any type of needs, we're available.
All right. You know, because I was looking at the map, I seen the little dots for substance abuse. So
yeah,
you know what?
We wasn't on the map. I told her that.
Yeah. So I am looking forward to you doing a linkage agreement with us and taking care of your business.
Yes. Thank you, guys.
You're welcome. Next up, we got my girl, Giovanna Smith. And it's so interesting because, Carol, I met Giovanna through you. Giovanna, you on mute, girl. Okay,
Happy
there you go.
New Year, everybody.
Happy New Year.
And it is such a pleasure. And Land 53, Family to Family, you all have done an outstanding job kicking this new year off. The presentation was simply wonderful. And as a member of DCFS and working with families and communities, for us not to have received this information first, it's kind of disheartening. However, you've allowed them to come, and we will take this information and take it back to our people. But I'm just looking forward to everything you all are going to do this year. Glad to be here.
All right.
And you know, I don't want to cut you off, but you know, I had to text y'all. I'm like, you all need to be on this meeting. Change the schedule. So I'm glad you guys can make it too. I'm sorry. Let me get out of Suzette's space. Go ahead, girl.
Okay, so next up we have my girl Kelsey. I've been trying to get Kelsey here for months. Kelsey, welcome, baby.
Hi, everyone. It's so good to be here. It is just always such a great space to be in and a great way to kick off a Thursday. So I'm really glad I could make it today. And I want to echo what Giovanna said. What a great presentation. I think as formerly supporting the land with some of that technical assistance, I think I just knew kind of exactly what Dana was getting at. And I think we all do, but it was really cool to see that there are plans in place to kind of make some changes, and to see 3 was being highlighted as like such a strong community group. It just is really heartwarming. So I just want to say that. I'm currently with the YMCA of Metro Chicago. We used to have a center in Harvey. We don't have any centers really in the south suburbs or even on the south side of Chicago. We have one near Hyde Park, but I'm hoping that changes. So I'm just wanting to attend to kind of learn more about the different service providers, and hopefully if there's any kind of programming that we offer that extends beyond like our center. Sometimes we do programming across the Chicago area or suburb area. I'm happy to share about that as well. But I'm so glad to be here.
Thank you. Full disclosure, Kelsey used to be our intern.
Yes.
And we are so proud of her and all of the work that she's doing now. You go, girl.
So yes, Kelsey.
I know, our baby.
I use what I learned every single day from you guys. So I appreciate having the opportunity to have been your intern.
Thank you. Next up, we have Lance Davis. Come on, Bishop.
There you go. Good morning, everybody.
Good morning.
How are you? And Happy New Year. So good to see you all again. And I really want to thank you, Lion, Suzette, and Kimberly. This was a great presentation. So I really appreciate you all going the extra mile to make sure that we were present to know about this good information. So really appreciative. I'm Lance Davis, Executive Director of an organization called BOOC. BOOC stands for Building Our Own Community. We're a family advocacy center for DCFS, providing general counseling, parent coaching, parent training classes, as well as a partner of the Asian Health Coalition, focusing in on the needs and the actual wants of the community concerning mental health. So again, it was great to listen to hear the presentation today, and I look forward to diving in with you ladies in this work. So again, it's good to see everybody.
All right, thank you. Next up, we have Dejene Brown. Am I saying that correctly, Miss Brown? If not, please correct me. Oh,
I apologize. I'm trying to come off mute. It is
okay.
Dejene Brown. And
Dejene. Okay. All right, girl. I got you.
Not a problem. It's okay.
Okay.
I'm the Director of Racial Equity Practice here at DCFS. Work with Paula under our PEP. Just happy to be here. Paula has invited me at the last minute, so I was glad I was able to jump on and get some of the information that is very relative and specific to the work that we're doing internally. And so these types of partnerships are extremely important to us, because what we don't want to do is separate our efforts. If there's an opportunity to collaborate and for all of us to be working in tandem to address these needs that we see in our particular communities of need, it would be great. I see a lot of things happening ad hoc, and it just separates our resources. So I'm glad to be a part of this discussion, and I'm glad to find out more about what Land 53 is doing. Thank you, Paula, for inviting me. I normally don't have a capacity to sit in some of your land meetings, but I appreciate the opportunity today to be able to do that, and more than willing to learn more from what Paula is doing in this space, so that I continue to support her. We have been able to add some value to the PEP work with our university partners by providing some additional funding that helps them assist our community action teams with some more technical support on trying to get the things that they want to see done. Because a lot of times I understand that, being grassroots in some of these places and not having all of the supports that are needed,
That's why our communities are failing, because the supports are limited. So we are working to build those supports and resources for our communities, for the people that we're serving via our PEP project, and any way that the department will continue to be an ally in this work. Paula is your person. We'll make it.
Thank you, Deshnae. Thank you, and thanks for coming. Okay, next up we have Miss Teresa Ramirez. Teresa?
Hi, everyone.
There she is. Yeah, hey.
Happy New Year. I'm
Happy
back.
New Year.
As you can see, so I'm with the Nurse Family Partnership Program. So I'm the social worker for the program. We operate out of Metropolitan Family Services, and it's a program that serves low-income pregnant women, high-risk pregnant women. So I'm back.
Okay, well, thank you. And I'm glad I didn't have your email specifically, but I sent it to Kelly. So
Yes,
tell her we missed her. So we'll see her next.
yes. Okay, I'll let her know.
Okay, all right. So next up, I think I'm gonna try this name. Katarine. I do not know.
Sabina.
Okay. Where you at, girl? Okay, there you are. Okay.
Oh, sorry.
Oh, no worries. Okay, no, wait, pronounce your name for me again.
Katarina.
Katarina. Okay, Katarina. And your last name?
Sherbina.
Sherbina. Okay, Katarina Sherbina. Welcome, darling.
Thank you. Thank you. So I am from UCP Seguin. I'm the board certified behavior analyst for the children's department here. We work with a foster care side, as well as we just started group homes. We have 2 group homes that opened up, and our agency, we assess kiddos and try and place them with foster parents, or we sometimes get referrals for our group home, where we try to stabilize and do a step down. So our agency has nursing, behavior. We're trying to build up therapy, a therapy department, case management, and licensing. But yeah, that's a very short description of what we do.
Well, welcome. And let me just say, since this is your first time here, we meet every 3rd Thursday of the month. And I guess Kim must have had your email address. Okay, so we will be inviting you back, my darling.
Okay, thank you.
You're welcome. Next up, we have Tila Mims, my lion sister. Tila?
Boop. Hi there.
Hey.
Good morning, y'all.
Good morning.
This was a wonderful morning after all. I tell you, you guys made my morning, because it's the beginning of the new year, yeah? So I am Tila Mims. I'm a fellow Lion. I'm glad to be one. We project work with a organization called Family Voices. And I am a parent with lived experience. I love that language. And I am just now realizing the impact that autism has on mental health. As my son gets older, I'm recognizing that. So this is just so timely and so relevant in so many ways for so many families. Glad as usual to be here, and I'm gonna keep letting y'all drag me through this.
Well, we love you and thank you for coming and thank you for being here, because I didn't have your email address, but I was like, Kim, please call or send Tila an email, and she did. So yeah.
I look at my family to family email.
Okay.
So
all right. Okay. All right. So next up we have my lion sister, Kristen Hadley.
Hi, everybody.
Hey.
I'm Kristen Hadley. I'm the director president of Alabama Service CP and ADHD Networking Group. We are a organization that's under the umbrella of Family to Family. Our I'm the director over the disability department of family. Did I get that right, Kim?
You are our resident disability self-advocate.
Yes, you are.
Yes, I am. And I always be on the land. I'm a lion, like
Yes.
most of you guys. And I'm happy to be here.
Well, thank you, Kristen, and we're happy to have you here.
And I'll just say, Kristen will be speaking for the statewide Alliance of People with Disabilities in February. So I will make sure that you all get an invitation to come out and support her presentation. Congratulations, Kristen.
Very good. So next up, we have my girl, Felicia Houston. Felicia, Happy New Year, baby.
Happy New Year. Happy New Year. Good. It's still morning. Yes. Good morning, everyone. My name is.
Good morning.
Had to make sure it's still morning. Good morning, everyone. My name is Felicia Houston, and I am an independent mental health consultant. I work with many people that are on this call. So if you need any assistance, feel free to reach out to me. I'm a trainer for mental health first aid, trauma and resiliency. Something new on suicide. I just went through a trainer on suicide, specifically in the Black church. So if you, and then trauma and resiliency, and something else called companionship. So I'm trainers for all of those. And that's how I spend my time going around or on virtual spaces doing trainings. So it is a pleasure to be here. And it's a pleasure to see all of you. We all made it to 2024. So thank you.
Yes. All right. And it's our pleasure to have you,
yeah.
Felicia. Next up, we have Miss Faith Hawkins. Faith.
Good morning, everybody. How are you? I am Faith Hawkins. I'm with Book Family Advocacy Center in South Holland. I'm the program coordinator. We're an FAC program, so we do counseling, parenting, domestic violence, just about anything. We get our referrals through DCFS, but we do take community referrals. So if you know anybody needs some services, send them on over to us. And we're always looking to see if anybody would like to join us in our parenting to do a presentation or anything.
Okay. All right.
Absolutely.
Thank you, yeah, absolutely. Thank you. Next up, we have Mr. Gene Seaman. Gene, where you at?
Hi,
oh, there you
everybody.
go.
Gene.
I've just been hiding.
Well, welcome.
Yeah, well, thank you. And thank you, Kimberly. You sent me an invitation to come. It was a great presentation. I work for a state agency called Illinois Guardianship and Advocacy Commission, specifically the Human Rights Authority division of that agency. And we're an agency that is put together to advocate for the rights of people with disabilities in Illinois. We do it through 3 programs. There's Office of State Guardian and Guardians of Last Resort for adults in Illinois. So when people talk about this, state being the guardian, it's us. Legal advocacy services, and there are legal department, and they do a lot of mental health commitments, appeals, appellate work. And then the agency I work for, the Human Rights Authority, we investigate rights violations committed against people with disabilities and all disability providers, all ages. Then we also have a collaboration between the HRA and the Legal Advocacy Services, and it's our Special Education Collaborative. And essentially, they're put together to assist families in navigating special education programs. So they'll do anything from answering questions, putting together letters, putting together emails, attending IEP meetings, and legal services for like due process hearings and things like that. So it was great to be here. There's a lot of excellent information that our agency is really interested in. And thanks to everybody, and thanks to Kimberly.
Well, and thank
you for joining us.
Yes, exactly. All right, next up we have Marianne Bitos. Marianne. 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 Okay, well, you know what? We'll come back to Marianne. And then we don't have a name, but we have a phone number, 773-750-6206. And I don't know who you are, but if you want to come on, and there you go.
Here we are. I am Lion John Chisholm. I am a member of the Inglewood Lions Club. I've served District 1A as the district governor. I've had other positions prior to that. I retired in 1998. I worked 5 years
Hey,
after
how are
that.
you? How's it going?
After that, I worked 5 years as a consultant for U.S. Equities, one of the largest property management firms in the city. And I met Kimberly at a district convention. She invited me this morning. I am not in the mental health field, or am I part of a service organization other than the Lions. But listening to this is really interesting, and it gives you some insight into things that need to be done to help folks get on their feet and be stronger citizens, family members, and parents. So thank you for inviting me.
Well, thank you,
Thank you
Lion
so much.
John. Yeah, I think Kimberly, I met him at the event that we had for was at the VW?
The regional meeting, yes.
Right. Well,
He won the 50-50 raffle.
Yeah.
Right.
Well, I'm glad you connected, Lion John. We'll definitely connect after this.
I am a lucky stiff.
Well, and we are lucky to have you with us today. So Marianne says she can't take herself off of mute. Can you do that for her?
So let me see, Marianne. You should be able to, let's see, I'm gonna ask you to unmute, and let's see if you can click on unmute from there.
Marianne?
Yeah, I don't have any restrictions on your mute. So I'll kind of work with her in the background here.
Okay, well, let me see. We asked her to unmute. That's what I got. She can't. Okay, so Marianne is with NAMI, South Suburban NAMI. And I don't know, Kim, I don't know what you want to do with that. But, I'll tell you what. We're just going to keep this ball rolling because it's 11:30. And I just want to give our executive director, Kimberly Haynes, a chance to talk about the vision that she has for, oh, is that Marianne? Oh, wait a minute. Marianne? No? Okay. Well, Kim, we're just going to.
It looks like she tried to rejoin. Maybe we'll come back to her.
Okay, we'll come back to her. But I wanted to have Kimberly Haynes, our executive director of Family to Family, talk about the vision for 2024 and to discuss the governor's Children's Behavioral Health Transition Initiative. You don't know, that's a mouthful, but I got it all out there.
Oh, did we already introduced everybody?
Yes, yeah. Well, there's one person, Mary Haverson.
Marv, it looks like.
No.
Marv.
No, Mary. Mary, if you could take yourself off of mute, she's right next to.
Oh, it is. Look, I don't have my glasses. I should get them.
Okay, well.
But go ahead.
Okay, Mary. Mary took herself off of mute.
Hello.
Hello, welcome, Mary.
Hi.
Thank you so much. Sorry, I was having some computer issues. Good to see you.
Okay, all right. And now, where are you from, Mary?
From Chicago, Illinois, and I work at Lurie Children's Hospital.
Oh, hey, Lurie Children's.
Welcome.
Thank you.
Okay.
All right, so Kim, you just want to jump on in there and talk about the vision?
So first of all, I want to, I can't express how grateful I am that everybody has come out. I got the email about the blueprint maybe several months ago. And when I started reading through it, I do read that kind of stuff. So when I started reading through it, I said, oh my God, I'm hoping that this will be something that will help bring resources back to Land 53. I started my journey in the land as a parent advocate, and this was, let's see, at least 20 years ago. And I always talk about how that experience with the land really helped me understand a lot of things about how the community works, and really put me in a position to be able to work with some phenomenal people who were very community minded, who were very dedicated to their work. We had a lot of grassroots organizations that were funded through the land. And the community landscape was different. And yes, I'm that old that I can talk about back in the day. But I like to tell people, if you had a kid who was struggling and needed to just kind of get into something a little bit more structured, to be under the supervision and to practice social skills, because now we're at a point where we're trying to teach social skills. But we used to have communities where kids could practice social skills. They could go outside. It wasn't only sports. It wasn't only behavioral health hospitals. We had a lot of things for our kids, and there were things that they could walk to. And, when I came back to the land, we were meeting over at District 148, and that was always one of our strong partners. But we would have 3 or 4 people come every month, and most of the time it wasn't even the same 3 or 4 people. And we were fortunate to be intuitive enough to move to a virtual platform. And we did that strategically because we understood that for people coming from Bloom or Bremen or, some of our DCFS partners, traveling out to the south suburbs to have a meeting with 2 or 3 people, I mean, it's not always the best use of time. And then we were in a situation where, DCFS wasn't giving us any money, but we were still trying to hold on to the mandate of the BH consent decree, which talks about making sure that children have access to mental health services and educational support services. And of course, any agency like DCFS is going to have some levels of structure that they're wanting to hold the community to some standards. And, we still are in support of those efforts. And we're very proud to be a part of the Permanency Enhancement Project. And so what I really wanted to be able to do is to have Dana and her team kind of come out so that you all could kind of hear the same information that we've been privy to hear and understand, and really move that to be a leverage and a catalyst for this body to consider coming together in a slightly different way. At one time, the lands were when there was money. When you have money, there's things to talk about, right? So you got reports from this program, you got reports from that program, because people are reporting on the money that they're getting. When we don't have that as the centralized conversation, then it's kind of hard. But I do want to say that what we have been able to do is to uncover some very innovative providers. If you guys got a chance to take a look at the list that Louisa sent us, a lot of you all aren't even on it. When I go to the Spider database and put in my zip code, I don't get anything within 20 miles of my home address. And so I think what we have been able to do with the support of our team is to start getting people more familiar with each other, to start to build those relationships where we know who's doing what, and we can make referrals to these services in a way that better supports our family. So one of the things that I wanted to extend as an invitation was for people to become more formally connected to the Permanency Enhancement project. And I think, is Dejanay and Paula still on?
Paula is. I don't Dejanay, I don't know.
I am still here. Yes.
Okay.
Okay. Well, hey, so so you guys can definitely correct me if I'm wrong, but I'm gonna kind of try to explain what the permanency enhancement team would be doing. And this will be representing Bloom, Bremen, Rich, and Thornton Townships. And that is about 52 different cities and municipalities. So I'm going to tell you, there's going to be some challenges, but I think that with the way that DCFS is moving, I know we've talked about data, and Dejanay, I'm glad to hear that you are kind of standing in that space, because we miss our university partners. I reached out to Dr. Geiger the other day, and I have to say that we've had a phenomenal relationship with Dr. Geiger. The interns that we've had, Kelsey and Megan, I think Dr. Geiger picked them for us. You know, she sits with us and listens to where we're going and what our needs are. And when we get those interns, they are phenomenal. And we put them to work. I don't know what the other lands do, but they work with us. And when those interns leave us, they know what they're doing. Okay, we take good care of them. But the permanency enhancement project is really, the purpose is to look at county level permanency enhancement data, looking at families that are have children who are in the system, and looking at ways that we can bring those families back together, whether it's services, whether it's addressing community safety, environmental, or personalized. And one of the things that has really been on the forefront of the conversation, and Dejanay kind of spoke a little bit about it in terms of looking at equity. And we have a lot of our Black and Brown children who are disproportionately impacted by the child welfare system. So more of our children are going into the system. So what the PEP teams, permanency enhancement, what our teams are to do is to mobilize community stakeholders like we're doing now. You know, anytime DCFS comes to one of our meetings, somebody's going to send a chat in the background and say, I need to talk to you because we need that service. We need that resource. We need what you're offering, right? And we want to mobilize community stakeholders. But I think one of the things that we've talked about as a team is that we also need to be able to capture this data, right? You know, what services is the department looking for? What services are needed in the community? And how is our network able to fill those gaps? So it's not about not wanting to have the individual connections, because that's what makes us thrive. But I think being able to come together so that we can sing a song as a choir, right? So we can say, this is what we're doing as a network. This is how we're impacting. And these are the resources that we need to make sure that we're able to help the smaller organizations grow, to seed new programs. And one of the things that, and I hope you guys get a chance to read that blueprint, because it really is a good read, addressing the behavioral workforce shortage. You know, it's not that we have a shortage of clinical staff. We've got what, 3 hospitals on here now: Lurie, Hartgrove, Sartoma Center just jumped off. We got River Edge. We got hospitals. We got places. We got hospitals. That's not the problem. We don't have after-school providers. We don't have mentors. We don't have people who teach grassroots stuff. You don't have dance anymore. You don't have any of those things that are tangible. You know, when we talk about social and emotional learning, and I won't go into it, but I spent 6 years doing research and development and creating curriculum. And we're missing that community-based layer of those non-clinical social programs for kids. And so what I'm asking people to do is consider to come together with us to really look at how we can piggyback off the blueprint. That they already have 12 strategies. And I'm one of those people, if you give me a document that got a little bit of evidence and some guidance, I can work in that, because now it makes sense. And one of the challenges that we've had in working with DCFS is that they don't put out RFPs. So if you don't tell me what you want, then I'm just grasping at straws, because we need so much that, it's hard to just, throw something at the wall to stick. But if we have an actual blueprint, I think that is going to be the catalyst to taking what we do and come together to really becoming very impactful. And I know that and talking with Dana and even reading through the blueprint, they like to pilot, and I think we have a very impressive and robust group of people that they wouldn't mind working with to help us even work out the kinks. And then, of course, the other piece is making sure that we can kind of come together and look at, what are some of the shared goals that are going to touch each of us, what are some things that we can agree on so that when we're in a position to have these conversations with representatives from the state and federal government, which we've even had. We've had people from SAMHSA at the federal level. We've had SAMHSA from the state level. So we have those connections. But we also need to be able to represent some movement in what we're doing, as well as to be able to put out there what are these impacts. One of the things that is very prevalent and is kind of a trending issue in the Southland, and this has been something that's been going on for a while. Of course, I already talked about the lack of local accessible grassroots programs. We have, great people who represent our school systems who are doing phenomenal work. And we do see a lot of schools bringing in more program. ISB is putting out more resources for school-based programming. But then we have a big problem with truancy and absenteeism. So what is happening with those kids that aren't even going to school, right? And so, I asked Suzette, I said, I never talk on the meetings, every now and then, because I'm in the background making sure people get in, if they get the link that we can unmute them. But I thought that this will be a great opportunity and a great time to really extend a very intentional invitation for people to consider becoming a part of the Permanency Enhancement Project and really helping us to grow that portion of our network and really shore up the support that we're providing to DCFS. And then maybe we can get Dejanay and Paula to cut us a couple of checks. Okay, I'm gonna leave Paula alone. I'm always messing with Paula, but and so I definitely want to unmic and kind of get your feedback on what you heard from Dana, kind of what you might be thinking in terms of how does that translate to the work that we're trying to do as a network. And I know I see Dejanay has her hand up. So Dejanay, go ahead.
Okay, let me just say this. We got 15 minutes. Suzette. I'm sorry, we got 15 minutes. Okay, go ahead, Dejanay.
Thank you, and I'm not going to hold you. But Kim, I appreciate you calling us out. It's important to understand what the challenges are. And I understand prior to, there's a lot of changes that have happened over the PEP project over the years, specific to funding, leadership, et cetera. So I don't have a problem ever you calling us out, because that's how we know what we need to do. How can we do it better, and what efforts we need to be doing in order to do that. So while you're in the background sending a note on who you need to contact, I'm already telling Paula who she needs to contact. We've been already doing this on the phone because it's important. It's important to what you're trying to accomplish. And it's important for us, for the families we're trying to serve. So as we continue, as Paula continues in this discussion, and I hear you, funding. You're not the only person that's talking about funding. How do we get there? Paula will tell you that from day one I got in this seat, that's the first thing we were trying to figure out. How do we put funding in the community's hands? Because we understand there's a disconnect between, yes, I can support the university partners, but how do I support our community action teams and the folks on the ground? And even working with Dr. Geiger, I know we worked really hard trying to get one of the grants, proposal that came out to connect to work in our communities specific to our PEP program from her region. So this is not, it's important that you're sharing that, but it's a continued conversation that we want to have as we continue to strive to find avenues, which I'm having those conversations every day about how we get monies. You know, that all that accountability thing is in the place, but how do we really support our families through community efforts? So don't stop talking about it, and please keep on hounding on Paula, because Paula's not going to do anything but continue to hound on me about what we continue to do to help support you all. This work is important, and it needs to come from the community's perspective. So I just appreciate your voice, and I don't have a problem when you say DCFS did, DCFS didn't, okay? Because what we need to do is see how we can do it better, and I'm open to doing it better. So thank you. And I'm sorry, Paula, for jumping off. I got another call to jump on, but I wanted to lead you with that, Kim.
Well, welcome, Dejanay. I love your energy, and I hope you can come back.
Please do. Please do.
Go on, Paula. Now, Paula is she always listens to my fussing, but go ahead, Paula.
I do, and Kim, she stays on me and she keeps me on track. And just to piggyback, I don't want to take over, but I agree. You know, I did talk to Kim, and I know we haven't spoken in a while about the permanency enhancement project, but what I do want to talk about is some of the things that I shared earlier about revamping how we look at the permanency enhancement project, looking at 10 vital services for the lands to come together, utilizing data to talk about where the deserts lie in each of these communities, so that with that support that Dejanay talked about, doing and writing a strategic plan, or what you call a blueprint, to assess those service needs and to reach out to local and state and federal governments to prioritize where funding sources need to be rediverted to. We want to do upstreaming outreach. So the permanency enhancement is not only looking at it from a DCFS perspective, but from a community-led based initiative that the community tells what their needs are and be able to come together and say, this is what we want. I also challenge the state and local federal governments to do the same thing, to look at where the barriers lie. So the community, the permanency enhancement project, as it's known, will not be as it was, because we're looking at to actually have 100% community involvement. So holding stakeholders accountable. And what I mean stakeholders, everybody has a stake in this game. These families are within our community. So we're being able to reassess using data, using the support of our university partners to help strategically talk about where these deserts lie, be it food, be it transportation. And that's what Dejanay talked about in terms of funding sources. So we're asking, you guys to partner with us to come, doing surveys to find out where the needs are, who needs to be at the table, who are the reporters, so that we can develop, so you guys can develop and sustain yourself without the department's input, to develop and sustain those connections and those resources to do the work that you're already doing. So that's
thank you, Paula.
That's
the improvement of the permanency enhancement project.
And I appreciate that, Paula, because I think that's very confirming, because the reality is that we have not had any DCFS support. So there's not, so we're kind of in a spot where enhancing permanency for us is good business, right? Mm-hmm. It doesn't matter. It doesn't matter that it's a DCFS initiative or not. We want to see strong families because we're a family-run organization, and we understand that the family is the cornerstone. And if we don't support our families, then it's not just about the DCFS issue. We look at risk factors related to substance use disorder. We look at risk factors related to juvenile delinquency and criminal justice. We look at resources related. We look at risk factors related to economic stability, right? And so, we try to, everything needs a structure, right? And I like what you said about the 100% community involvement. So what I just did, I put in a chat box, because one of the reasons that we wanted people to register for this meeting was because we wanted to make sure we knew who was in the room. And you heard a few people say that we didn't just let the regular notice go out. We were texting and emailing and calling people who we thought would be very interested and that could benefit from this information. And we were also aware that we had several people who frequent this meeting who are from DCFS, who are from the County Department of Public Health, who are from these other agencies that are mentioned in this document, who probably didn't even know that this document existed.
Right.
And so what I'm saying is that we have so many resources in the room that even if another dollar isn't spent, if we were to be more strategic, to leverage what we have and be strategic about how we capture that data, how we talk about what it is that we're doing, I think that we'll be well on our way. So what I would like to do is invite you, Paula, and as well as Dejanay. I believe Dejanay had to jump off, but I want you to be invited to be at the table, because you're going to bring that expertise in terms of knowing what the DCFS system is like. But I don't think that we need to necessarily, Paula, you my girl, and I give you a hard time, but I know you are not DCFS. Do you know what I'm saying?
Okay, ladies, we got 8 more minutes. Ladies, we got 8 more minutes.
I'm watching the time.
I want to be able to say it's not about DCFS. It's about every agency at the community level, leveraging what they have, and our families being able to know where those services are and how they can access them. We're talking about prevention. So it's prevention, and
so
not only
Paula,
that.
I know Suzette is I can see her wagging her finger. We at the 11:53. So we all know Paula and I are both very passionate. So I will send out an email to everyone who was on the call today, asking if you guys would like to participate in some strategic planning for this region. Our goal as an organization is to really see these programs and services grow, to do our part in raising awareness about the services that are out there, to advocate for the gaps, for filling those gaps, but making sure that we bridge the gap between the people and the resources. So I will give Suzette this time to close us out. I will thank you all again for joining.
All right, so listen, we have someone that joined named Melissa Box. Melissa, I just wanted to give you a few minutes to introduce yourself, baby. There you go.
Hello. Sorry I had to join late. I didn't even get the invite till like half an hour ago. So I'm sorry I couldn't be here the whole time. Dejanay Brown invited me to join. I am the Family First Prevention Services Administrator for DCFS and a huge fan of the Permanency Enhancement Project. So I'm just loving just listening in on the conversation and brainstorming how Family First can support this community-based work. So
yes. So Melissa, can you make sure that Kimberly Haynes has your email address?
Did you register for the meeting, Melissa?
I did. I registered right before I joined.
Okay. Well, I have it. I will definitely be reaching out.
Okay. And then she'll send you a copy of the blueprint.
Perfect. I think I have the blueprint unless there's a newer version.
Is it, Kim?
No, I don't think so.
Okay. All right. So listen, we got 5 minutes left. And I just want to say thank you for everyone who joined in to start off the new year with us and our Zoom party. We will be back here next month, 3rd Thursday of the month. National Provider Network, sponsored by Family to Family. We welcome everyone to join again next month and bring a friend. So thank you so very much for joining us. We appreciate everybody's participation. And I hope people enjoyed the meeting. And if you have questions, you can email me, or you can email Kim, or you can email Ariel, or Kristen, or Erica, or Dr. Young. Okay? Thank you.
Thank you.
Thanks,
All right.
everybody.
Bye-bye.